everybody, Tribe Nursing here. Want to know more about whether a patient is in respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis? Then stick around to find out. If you are new here, my name is Tribe Nursing, and I make nursing content easier to understand. I make content related to nursing lectures, I even give study tips, and I even do vlogs. Make sure to hit that like button and subscribe. And if you are studying for your boards or just going into nursing school, make sure to look out for my NCLEX study guide and my head to toe study guide that you can find on both tribenursing.com. You can find a link in the description. And with all that being said, let's get started. So as I said earlier, there are different types of acid-base imbalances. There you have your metabolic acidosis, your metabolic alkalosis, your respiratory acidosis, and your respiratory alkalosis. So with metabolic acidosis, what will we see? What are the signs and symptoms, and what are the causes of metabolic acidosis? So for the signs and symptoms, we're going to see a patient complaining of a headache. Their blood pressure is going to be on the lower side. Their skin is going to be warm and flushed, and they're going to have decreased muscle tone. As far as the causes, you will see patients who have liver failure experience metabolic acidosis. So why is that? It's because with liver failure, these patients are usually experiencing low bicarb, that low HCO3. Same thing with diarrhea. When a patient has diarrhea, they will also experience low bicarb levels, as well as renal failure. Renal failure could throw a patient into metabolic acidosis. How about metabolic alkalosis? Signs and symptoms of metabolic alkalosis, you'll see that the patient be a little confused. They'll experience some dizziness, some lightheadedness. They'll be pretty irritable and have high anxiety. So look out for those signs and symptoms. What are the causes of metabolic alkalosis? Antacid use. Taking too many antacids, such as calcium carbonate, which is also the generic name of Tums. That increases the bicarb level, which increases the HCO3. Prolonged vomiting. When a patient is continuously vomiting, their bicarb level will continually increase. So that is something to look out for. And that will throw a patient into metabolic alkalosis. Respiratory acidosis. These patients are usually hypoventilating. Let's think about it. When a patient has respiratory acidosis, they will have more of shallow breathing, more of slower type of breathing. So what does it mean when a patient has slower breathing? Well, let me go ahead and explain. When a patient has slower breathing, they're retaining more carbon dioxide. They aren't expelling that CO2 that's within their lungs. Remember, within the lungs, the alveoli are exchanging O2 and CO2 constantly. Now, when you are not expelling that carbon dioxide, it's going to build up. And where do they usually find that carbon dioxide? Within your blood. So shallow breathing could cause respiratory acidosis, and a patient could be hyperkalemic, so with a high potassium. The normal value of potassium is 3.5 to 5. Now with a patient who has respiratory acidosis, their levels are going to be above 5. Now the reason why a high potassium is bad, it could actually be fatal, because we are looking at what system? If you said cardiac, you are on the money. It can cause dysrhythmias, and not any type of dysrhythmias, lethal dysrhythmias. So make sure to look out for high potassium with your patients who are experiencing respiratory acidosis. Respiratory alkalosis. What are we seeing here? Kind of the opposite, right? These patients are going to be hyperventilating. What does that mean? That means they are expelling too much carbon dioxide. Now, if they're expelling too much carbon dioxide, nothing is going to be balanced. These patients are going to experience tachycardia, they're going to have seizures, low potassium, and low blood pressure. Again, how I was explaining earlier, potassium needs to stay neutral within that 3.5 to 5 range. Even with a potassium that is low, it can cause dysrhythmias. Let me test your knowledge super quick. What happens if a patient has low potassium that is under, let's say if a patient has a potassium of 3, what will you see on the EKG? What will be affected the most? Is it the P wave, QRS, or the T wave? If you said T wave, you are correct. You will see more of an inverted T wave with a patient who has respiratory alkalosis, because a low potassium could cause an inversion of the T wave. Also, you want to look at a low blood pressure as well. Monitor your patient's vitals. Hyperventilation. That is a major cause of respiratory alkalosis, because you're expelling a lot of carbon dioxide. And mechanical ventilation. What does mechanical ventilation mean? Patient who comes in and cannot breathe on their own, who are mechanically ventilated, who is on a ventilator, could cause respiratory alkalosis because of the tidal volume and the amount of breathing the machine is doing for you. This patient is going to be expelling too much CO2. Okay, so how do you determine if a patient is in respiratory alkalosis, acidosis, or metabolic alkalosis, acidosis? Well, let's do it the tribe nursing way, okay? Step 1, we're gonna draw our arrows. We're gonna draw 3 straight lines. 1, 2, 3, and let's make these into arrows. Right here we're going to write 7.35. Up here we're going to write 7.45. Right here we're going to write 35 to 45. And 22 to 26. 7.35 to 7.45 is going to be our pH. 35 to 45 is going to be our CO2. 22 to 26 is going to be our bicarb, our HCO3. So you're probably asking, okay, what now? Well, let me go ahead and show you. At 7.35, this patient is acidic. So we're going to write acid right here. CO2 of 35 and below is going to be alkalotic, ALK. A bicarb of 22, a bicarb less than 22 is going to be acidotic. So we're going to write acid. A pH above 7.45 is going to be alkalotic. A CO2 above 45 is going to be acidic. And a bicarb above 26 is going to be alkalotic. Well, you're probably thinking, tribe nursing, there has to be a easier way to remember all of these. I got you. Acid, ALK, acid. Acid, ALK, acid. Remember to always put acid in the front, ALK, acid. And it's going to be the opposite when we go up. ALK, acid, ALK. Acid, ALK, acid, ALK, acid, ALK. It just flip-flopped. So that's how you can always remember it. So on your NCLEX or on your nursing exam, you're going to get 3 values. You're going to get your CO2 level, your bicarb level, and a pH level. Okay, so here I wrote to the side our values. We have our pH, our CO2, and our bicarb. So let's start with pH, our 7.6. So let's not look at any of this, let's just look at this one arrow, okay? 7.6, where in the spectrum does this fall in? 7.6 falls above here, because 7.6 is greater than 7.45. Is just put a check mark right here for pH, okay? CO2. where does CO2 fall in here? CO2 is 50. CO2 is going to be greater than 45, so we're going to put CO2 here with a check mark, okay? And bicarb. Bicarb is 36, so we're going to put it above the 26 because it's greater than 26. So we have our values. Let's set up our tic-tac-toe. Okay, so for the first one, we're going to start with our pH. Our pH was 7.6, so we know it's alkalotic because it falls above the spectrum, so it's alkalotic. So where do we put it on our tic-tac-toe board? Okay, the A stands for acid, the N stands for neutral, and B stands for base. So if it is alkalotic, we're going to write the word we're going to write pH in the alkalotic box. So we're going to write pH over here, right? Alkalotic goes in the alkalotic box. Okay, how about CO2? CO2 was 50 and it is acidic. So we're going to write CO2 in the acidic box. So CO2. Okay, we don't have a tic-tac-toe yet, right? And then we have bicarb. Our HCO3 is 36 and it falls above the alkalotic spectrum. So it is alkalotic. Sure. So we're going to write HCO3 over here in the alkalotic box. Now there's no more room. We have a tic-tac-toe. Well, now you're asking, how do you determine if it is metabolic or respiratory? What I like to keep in mind is that our A is respiratory. Our B is metabolic. Okay? So we know that our bicarb is down here, right? So that's our bicarb, HCO3, that's alkalotic, and B is metabolic. So now we have metabolic, alkalosis. Let's go through that again. B is metabolic. HCO3 is alkalotic. HCO3 is alkalotic, CO2 acidotic, right? So we have our tic-tac-toe. So we have metabolic alkalosis. There you go. Now, how do you determine if it is partially, which is our step 3, partially or fully compensated? When you have your tic-tac-toe, if you have a value, doesn't matter what it is, CO2, pH, if it is on this side, just mark an X. If it is one box separated away, it is considered to be partially compensated. Let's say if the CO2 was sitting over here, it would be fully compensated. So that is the end of the video. I hope you all learned my way of doing acid-base imbalances. I have been told it has been very beneficial with helping others. This is with my own twist with the arrows. The arrow method is great just for organizing your thoughts to see where exactly what's acidic and what's basic. If you did like this video, make sure to give it a like and subscribe if you are new here. And with all that being said, thank you so much for watching. My name is Tribe Nursing, and have a good night. Peace.